about controller inhalers. Where can I get one? How do I start one? So that you're both on those medications. There are other things that are additives to those two, but those are the mainstay. Controller inhalers and reliever inhalers.
Wow. What are other treatment modalities away from this that can be given to these people?
What we want to emphasize is, can we learn how to use those things at home so that we minimize coming into the hospital with attacks?
Yes, actually talk about attacks before we plan to cross the shore.
So we've talked about a number of triggers. Those triggers can make you get an attack. And when you have an attack or what we call acute asthma or an exacerbation, it can be mild, in which case I think you've seen some people, they go into the hospital, they get nebulized, they go home happy. It can be moderate, where you need more. You can have a severe attack, where you actually even need more care. And then you can have a life-threatening one, where, you know, life-threatening is, you know, it's any day or any time now things can go to the wrong side. So when you have an attack, it's important to go to the hospital so that we know if it's in one of those grades and we give you the appropriate medication. There are so many things that we can use apart from the salbutamol that we've talked about. There are other additive inhalation medicines. There are other injectable inhalation, injectable medicines that we can use to control. But all in all, what I want us to understand is when it's an attack, antibiotics have no place there. Syrups have no place there most of the time. So let's not waste a lot of time getting antibiotic injections and syrups as opposed to getting the right care in the event of an asthma attack.
Wow. Talk about antimicrobial resistance while managing asthma.
There is a tendency for any form of illness that is out of the usual. This cough is not usual, let's add an antibiotic. This cough is not usual, let's put a cannula and we give an antibiotic. So that's very common. Actually, one of the ways we have seen it manifest is in schools, where parents are packing antibiotics and even injectable antibiotics for their children with asthma to share with the school nurse that in case the child starts to cough, please give this one, instead of learning how to use their controller and reliever medications well. So maybe the misconception about what type of cough we are dealing with and how to manage an attack is what is driving us there. But my advice is, can we learn to use our inhalers very well and minimize the wrong use of antibiotics, whether oral or injectable? When we do better with our controller and relievers, we shall be minimizing the need for those other interventions.
Excellent. Thank you so much, Dr. Namli. And of course, our viewers are very appreciative on the social media platforms, and they're learning lots related to this very important condition. In a bid, of course, now to call upon the government, what can we do on policy reforms when it comes to this condition? But of course, also talking to mothers or guardians who have or live with children or people with such condition. And of course, now we are drawing the key take-home points. And also for frontline health workers, especially the nurses in health center, 2s, 3s, what can they do, what can they start with all the time they encounter such cases? We can begin with the community or the person.
I wanted to begin with the big people.
Please. Okay, please, begin with the government.
Yes, my appeal to the government and all the powers that be, let's avail inhalers in our primary health care settings. When we learn to use them, we shall also minimize catastrophes related to asthma attacks. So if you're out there and you're involved in policy making, please, the cry should be, let's have our controller and reliever medications, those are the inhalers, available in the primary health care settings. At those levels, children are also presenting. Then what I want to encourage the communities out there and even the lower health center workers even if you do not have a nebulizer, it doesn't mean that you cannot manage a child who has an attack, especially if it's not life-threatening. You can start somewhere. Learn to use the inhalers, learn to use them right. Maybe what I can also emphasize that we missed